This solution is used to help with a specific type of cancer called uveal melanoma. Tebentafusp is in a group of drugs called monoclonal antibodies, which help slow down or stop the growth of cancer cells. It is important to follow the dosage instructions provided by your healthcare provider. The best time to take this solution would be as per your healthcare provider's recommendation. Before starting Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution, it's important to read the patient information leaflet from your pharmacist. This medication is administered by injection into a vein as directed by your doctor, typically once a week. A healthcare professional will administer the injection, which usually takes 15 to 20 minutes. Your dosage will be determined based on your medical condition and response to treatment. Your doctor may also prescribe other medications, such as dexamethasone, to help reduce the risk of side effects. Additionally, your doctor may start you on a low dose and gradually increase it. If you experience dry or itchy skin, changes in skin or hair color, swelling, or muscle/joint pain, be sure to let your doctor or pharmacist know. Serious side effects may occur while using Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution, but your doctor has prescribed it because they believe the benefits outweigh the risks. Keep a close eye on any signs of liver problems, such as nausea, loss of appetite, stomach pain, or yellowing of the eyes or skin. While skin redness, itching, swelling, or rash are common, you should still notify your doctor if you develop a rash, as it could be a sign of a severe reaction. In the rare event of a serious allergic reaction, seek medical help right away. Be sure to contact your doctor or pharmacist if you experience any other effects not listed above. Please consult with a healthcare professional for personalized advice, and do not hesitate to reach out for medical advice if you have any concerns about the medication. Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution can cause a serious side effect called cytokine release syndrome, CRS, which can sometimes be fatal. Because of this, you will receive this medication in a hospital or clinic so that your doctor can closely monitor you for any serious side effects and provide immediate treatment if necessary. After the first 3 treatments, you will be monitored for at least 16 hours, and for at least 30 minutes after later treatments. If you experience symptoms such as fever, chills, headache, nausea, vomiting, stomach or abdominal pain, difficulty breathing, skin rash, tiredness, or low blood pressure, it is important to inform your doctor right away. If you do experience side effects, your doctor may temporarily stop or slow down your treatment with this medication. They may also prescribe other medications to reduce the risk of side effects before you receive Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution. Before starting Tebentafusp, make sure to inform your doctor if you have any allergies or medical conditions. This medication may cause dizziness, so avoid driving or using heavy machinery until you know how it affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. If you are planning to have surgery, let your doctor know about all the medications and products you are using. It is important to discuss pregnancy and birth control with your doctor before starting Tebentafusp, as it may harm an unborn baby. If you are breastfeeding, consult your doctor before using this medication. When taking Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution, it's important to be aware of potential drug interactions, as they may alter the effectiveness of your medications or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If someone has taken too much Tebentafusp-Tebn and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to undergo lab and/or medical tests, such as complete blood count and liver function tests, while using Tebentafusp-Tebn 100 mg/0.5 ml intravenous solution. Make sure to attend all medical and lab appointments. This medication is used to treat a certain type of skin cancer and should be administered intravenously. Follow your doctor's instructions for the correct dosage and timing of this medication. Make sure to take each dose of Tebentafusp-Tebn 100 mcg/0.5 ml intravenous solution as directed by your doctor. If you happen to miss a dose, be sure to speak with your doctor or pharmacist to get a new dosing schedule. This medication, Tebentafusp-Tebn 100 mcg/0.5 ml intravenous solution, is administered in a hospital or clinic setting and should not be kept at home. It is used to treat certain types of cancer and is given through a vein by a healthcare professional. The dosage and timing of administration will be determined by your healthcare provider based on your specific condition and medical history. Be sure to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.